Welcome to Alzheimer's disease, episode 2. Here we take a deeper look at Alzheimer's disease, indicating its devastation. We'll define Alzheimer's disease. We'll be able to distinguish Alzheimer's disease from other types of dementia. We'll discuss why we consider Alzheimer's disease to be a very devastating disease, possibly the most devastating disease of all time. We'll look at the stages in the development of Alzheimer's. We will further discuss the signs and symptoms of Alzheimer's disease. And we'll look at the risk factors for Alzheimer's and the known causes of Alzheimer's disease. And we question the rationale for the higher incidence of Alzheimer's among females than among males of equivalent age groups. Alzheimer's, we talk of it as being the most devastating disease of all times. And the obvious question is why? Let's just pause a moment to reflect on this statement. Alzheimer's disease, a most devastating illness, and possibly the most devastating disease of all time. Alzheimer, as we know, is a brain disorder that slowly destroys our memory, the thought process, and eventually the ability to perform simple tasks. It tends to be progressive. One sees our relatives and friends deteriorate, becoming simply shells of their normal former selves. This is a most painful experience to relatives, friends, and even caregivers. It is regarded by some, based on this, to be the most devastating disease of all times. Simply put, our relatives or friends do not look ill. Initially, they seem to be playing a game with us, pretending to be forgetful, but then that pretense becomes serious, and we then have to take it seriously. So here we have individuals whom we have known for years, and suddenly they just don't seem to be relating to us in the way they normally relate to us. And even in the more advanced stages, they may not even recognize us, which makes it unbearably painful. And further to that, we are not even able to converse with them, to keep a meaningful conversation with them. The ability to converse is just not what it used to be. Hence, it affects everybody around them. So that's why most will consider it to be the most devastating disease of all times. I'll go on to say, imagine your relative or friend does not appear to be physically ill, but just seems to have an issue with his or her memory that is becoming progressively worse and agonizingly painful. A progressive death, if you will. Conversations with them become meaningless and difficult, quite an emotional drain. We speak of Alzheimer's, we speak of dementia. Are they the same? Let's see if we can distinguish between the both types. Lest you become confused, we'll distinguish between dementia and Alzheimer's disease. Dementia is a general umbrella term, if you will, used to describe a decline in mental ability severe enough to interfere with your daily life, while Alzheimer's is a specific disease process. Alzheimer is the most common type of dementia. That's why we tend to use it interchangeably, dementia, Alzheimer, because every type of Alzheimer is dementia. Every type of dementia is not Alzheimer's, but the most common type of dementia is Alzheimer's disease. So what are the symptoms? How do we distinguish one from the other? Basically, the signs include the changes in the brain, which may commence up to 10 years before the symptoms begin to appear. During the early stages, toxic changes take place in the brain. There's an abnormal buildup of proteins that form amyloid plaques and tau tangles. Previously healthy neurons stop functioning, lose their connections with other neurons, and die. Remember, in our previous podcast, we spoke about the value of the neurotransmitter acetylcholine in keeping our neurons alive, helping us to remain sharp and focused. That Alzheimer tends to attack that process and leads to the death of our neurons. As more neurons die, additional parts of our brain are affected. The brains begin to shrink and die. Obviously, if the neurons that form the brain dies, the brain will eventually shrink. And as such, our memory will be more seriously affected. In the final stages of Alzheimer's damage is widespread and brain tissue has shrunk significantly. There may be a decline in finding the right words to express oneself. Issues with vision and spatial orientation may also arise. Reasoning may become faulty, or judgment may all form part of an initial disease. I'm going through that again. There may be a decline in finding the right words to express oneself. Issues with vision and spatial orientation becomes more evident, and there's faulty reasoning and a judgment, which all forms part of the initial disease presentation. So you see, Alzheimer's affect basically every aspect of your memory. Previously, or even currently, we talk about death as being, apart from the absence of a heartbeat, we also speak about brain death, which is the brain stop or losing its ability to function as it should. Alzheimer just does that. Alzheimer is a type of slow, agonizing death to your brain. In Alzheimer's disease, portions of the brain dies over time. The area of the brain affected determines the symptoms. As brain cells die, the brain shrinks and becomes smaller. Since this disease, if left untreated, will progress, the patient will proceed to eventual brain death. In the process, he or she loses much of his faculties, which we take for granted. The process, though gradual, is progressive, and the patient loses the ability to take care of themselves. So essentially, what you see is Alzheimer is a progressive condition where individuals lose more and more of their faculties, and eventually they lose the ability to take care of themselves, with the final outcome being death. But if you understand death to be an element of brain dysfunction, or the absence of brain function, then you can understand why Alzheimer is a slow, progressive death process, since it actively destroys and kills brain cells. As the disease progresses, afflicted persons may appear worried, angry, or even violent. This is the 7th leading cause of death in the United States. That's Alzheimer, 7th leading cause of death in the United States, and it was the leading cause of death in the UK in 2018. It accounted for 12.18% of all registered deaths in the UK in 2018. The time which elapses between diagnosis and death varies from as little as 3 to 4 years if the patient is diagnosed in his late 80s. But in the younger age group, the time from diagnosis to death may be as long as 10 years. Can you imagine that? Watching your relative slowly deteriorate over a period of 10 years, just gradually dying, and you can do nothing about it? This is where Phillip Academy wishes to lend a hand. In order to make the whole Alzheimer disease process more readily understandable and more easy to appreciate, we have divided it conveniently into a number of stages. Despite that, I want you to understand that Alzheimer is a single disease, and it does not pause at any point and say, okay, we have finished stage 1, so on to stage 2. It doesn't do that. It's one continuum. But for the purpose of learning the features of the disease, we have conveniently broken it down into a number of different stages. So we talk about preclinical Alzheimer's disease, which begins about 10 to 15 years before the onset of symptoms. So even before you know you have Alzheimer's disease, there are changes in your brain which kind of precede the onset of symptoms. In stage 2, we talk about basic forgetfulness. It may seem to be a normal feature associated with aging. And as we mentioned earlier in a previous podcast, we expect one to have like gaps in his memory as he gets older because of the reduction in the volume or the amount of acetylcholine, that's the neurotransmitter in the brain. But in the case of Alzheimer, or as a premonition to Alzheimer, this basic forgetfulness seems to get progressively worse. Patients forget where he has placed his items. He forgets people's names, people he's acquainted to. He forgets the names. He even forgets where his car is parked. Okay? So when you start seeing those features, you should take note. it may be just more than age-associated forgetfulness. In stage 3, we notice obvious memory difficulties. This becomes increasingly evident and harder to blame on advancing age. It is usually at this stage a diagnosis is made. So we have a number of pre-warning features that we may just see and just make a mental note of. But the diagnosis is actually made at about stage 3, where there is noticeable difficulty in the patient's memory. And it becomes harder to blame these difficulties on just his advancing age. In stage 4, we see a worsening of the condition. As we said before, Alzheimer is a progressive condition. So we go through stage 1, stage 2, stage 3, and even at stage 4, there is a progressive worsening of the condition. So there's no letting up. There is more evidence of memory loss. The patients may have difficulty with language, organization, and calculations. The stage may last several years as the disease worsens. There's a stage 5. In stage 5, the patient becomes less independent. So that's where he puts a tremendous amount of pressure on his carers or his family members. There's difficulty in remembering people who are important to the individual, such as a family member. Can you imagine you walk up to a parent and the patient asks you who you are? The parent is asking his or her child who he or she is. Think about the mental impact it has on the person who is getting that sort of treatment. He or she is wondering what's happening. How has he changed? Your own parent doesn't know who you are, So, that is adds to the issue that we said earlier, that Alzheimer is probably the most devastating disease of all times. Not solely because of the impact it has on the patient or the sufferer, but the impact it has on the people around him or her. We also have at stage 5, there may be emotional changes, such as paranoia and hallucinations, as well as delusions. So you may have the patient talking about ants running off his skin, and there are no ants. He may start telling you about some grand event happening, and there's no such event. So he's having those delusional episodes, and he's also hallucinating. But that's not all. In stage 6, we have symptoms which are more significant and negatively impact on the ability to manage their own care. Communication may be challenging. Words and phrases can still be used. So the sufferer may be able to tell you one or two words, maybe able to use one or two words. But, it's difficult to really have a communication or any type of discussion with the individual. Expressions may be difficult. For example, they may be unable to describe the site of pain. Imagine they're telling you the elbow is hurting and the pain is nowhere near to the elbow. So that creates unbearable amount of stress, because you don't want your relative to be in excruciating pain. But if you cannot find the pain, what can you do? First of all, you cannot tell what type of pain is it. You're unlikely to know what is the underlying cause, because he cannot describe or cannot tell you exactly where the pain is. Hence, you cannot begin to appreciate the stress on the carers that such condition causes. And finally, in stage 7, the patient loses physical control. In Alzheimer, the brain cells are progressively destroyed, leading to severe mental and physical impairment. Loss of memory, as was stated in the children's discussion at the beginning of the podcast, is among the first symptoms reported by patients and their carers. And most people will talk about Alzheimer and say, hey, it's an issue of the memory. Yes, it is, but it is much more involved than just an issue of the memory. You see, with Alzheimer, it's progressive and also gradually reduces an individual's ability to take care of himself, in which case he or she is going to need help. Working memory and long-term memory are affected early during the disease. The particular type of long-term memory would be the declarative memory, as we hinted to earlier. Episodic memory is the most clinically relevant memory affected in the Alzheimer sufferers. Disruption to the episodic memory systems are among the earliest signs and symptoms of Alzheimer's disease. I'll take that whole part again. Right? Loss of memory is among the first symptom reported by the patient and their caretakers. Working memory and long-term memory are affected early during the disease process. The specific type of long-term memory that's effective is the declarative memory. Episodic memory is the most common clinical relevant memory affected in the Alzheimer's sufferers. Disruptions to the episodic memory systems are among the earliest signs and symptoms of Alzheimer's disease. Early in the disease process, such disruptions may result in misplaced items, such as not being able to find your car in the car park, misplacing your keys, missing appointments, and being late in your payment of bills are all features of the disease as it progresses. Obviously, you must be bothered by this impact on your well-being as a person who can suffer from this condition. For example, your relatives, you may be saying, well, hey, is there anything I can do to maybe slow down the process? I know it's going to be progressive, but can I do anything to help them a little bit? Give them a little more time with us, so to speak, where we can have the discussions, enjoy a little laugh, a little fun, maybe play a little game, that kind of stuff. Let's see if we can find some things or some steps that we can take to kind of slow down or arrest the progress of the disease. We talk about our nutrition. We say nutrition is perhaps the single most important factor that can either prevent or accelerate mental decline. A balanced diet rich in fruits and vegetables is a preventative factor. Diets with high saturated fats and cholesterol content are harmful, as these fats block blood vessels and are a major contribution to stroke and cardiac disease. As the brain is mostly made of fats, it is important to have a balanced diet. Omega-3 has been shown to be neuroprotective, and products like fish oil, soy oil, and walnuts are a rich source of this compound. The familial genetic history of neurodegenerative diseases does not necessarily mean that a person will develop mental decline. So if you have a family member who has had mental issues, especially Alzheimer's or even dementia, it does not necessarily mean that you too will develop that condition. Neurodegenerative diseases are still highly preventable by avoiding triggers in the environment and living a healthy, active life. One may expect to remain mentally alert until ripe old age. However, we have come to learn that infections may play a significant part in the onset of Alzheimer's disease. Follow me here. We mentioned one of the simple, relatively common viral infections, what a lot of people over the years may have had an attack on episode from. We talk about herpes simplex virus type 1. This is the same virus that causes cold sores, and for some reason it seems to be associated with Alzheimer's disease. I'll provide you with the evidence in a minute. But it is not far-fetched that viruses may affect you today, and even after their initial symptomatology and signs have declined, they remain active and alive in your neurological system. Viruses like chickenpox virus or varicella, viruses like chickenpox virus or varicella, which is interestingly a type of herpes virus, lives in our nerve roots for an extended period of time. You may at some point in your life, early years, develop some cold sores, which is caused by herpes simplex type 1. Chickenpox is also a herpes type of virus. Now, when an individual gets chickenpox, even when the symptoms or the signs disappear, that virus may go on to live for an extended number of years in your neuronal system. And when your immune system is suppressed in later years, you may start having episodes of reddish marks on your skin, a painful, we call shingles, which is also caused by the same virus that causes chickenpox, which indicates to you that that virus has an ability to live in our system for an extended period of time, even after the initial insult seemed to have been cured. But in the same vein, herpes simplex virus, which is again a herpes virus, is associated with Alzheimer's disease. Why do I say that? The virus is found in the brains of individuals who have died from Alzheimer's disease. But not only that, the DNA of HSV, that's herpes simplex virus, is also found in the amyloid bodies. Remember, we talk about amyloid plaques and tau tangles? So the HSV DNA is found in the amyloid plaques and the tau tangles in patients who have died from Alzheimer's disease. So we think it's not just mere coincidence. It is, we believe, associated with a definite impact that HSV has on Alzheimer's disease. But is HSV or herpes simplex virus the only organism to be blamed? No. We look at moles, which are very common in this environment. Moles, though, are funguses which are common in our homes and may contribute to Alzheimer's disease. Many have wondered why when they are at their homes, they feel sick and experience extreme fatigue. Once they go out and even on local holidays, they feel vibrant and well. It is believed that moles induce inflammatory changes in the brain which may destroy brain cells and lead to shrinkage of the brain, which is like a precondition to Alzheimer's. Could moles in our home play a part in our development of Alzheimer's? Would be appropriate here. But moles produce toxins which have a dual role. That is, they weaken the organism on which they come across, as well as they ensure their own survival. We speak about infectious diseases. We mentioned herpes simplex virus as a potential causative agent for Alzheimer's disease. But what about moles? Moles are fungi which are common in our homes, and they may also contribute to the onset of Alzheimer's disease. Many have wondered why when they are at their homes, they feel sick and experience extreme fatigue. But once they go out, even on local holidays, they feel vibrant and well. It is believed that moles induce inflammatory changes in the brain, which may destroy brain cells and lead to shrinkage of the brain. Could moles in our home play a part in our development of Alzheimer's? We know that moles produce toxins with a dual role. One, they ensure the survival of the mole, and B, they weaken the host. We also know that moles cause inflammatory changes in the brain. Because of these inflammatory changes, we expect them to, or we know that it will lead to destruction of neurons, which essentially causes a shrinkage of our brain, which is a condition that is common in Alzheimer's sufferers. We talk about age. Is age a factor in the onset of Alzheimer? Let's see. With this almost ceaseless insults from the environment polluting toxins, the exposure to heavy metals, the poor nutrition quality of our Western diet, our gross inactivity which heralds obesity and cyclic sedentary lifestyle, it's no surprise that our risk of developing degenerating brain diseases such as Alzheimer's is skyrocketing. We have also seen the effects of combat sports on our once exciting athletes as they age. This naturally points to the impact of the traumatic brain injuries on the development of this neurodegenerative disorder. As one gets older, he or she experiences gradual changes to his or her brains and bodies. This may affect our physical and mental abilities. There will be memory difficulties, but these difficulties are not noticeably disrupting our daily lives, affecting our ability to complete tasks as you usually would. You experience no difficulty in learning and remembering new things. There's no underlying medical condition that is causing your memory problems. Then this may simply be the product of aging and does not mean you have dementia or Alzheimer. So if we look back at those pointers we just pointed out, we can, to some extent, some degree, distinguish between age-associated memory impairment and Alzheimer's disease. For example, with age-associated memory impairment, there is, as one gets older, obviously there will be some changes in his mental faculties. But we need to try to distinguish this from Alzheimer's disease. So we expect an aging person to experience a gradual change in his or her brains and body. This may affect his or her physical and mental abilities. There will be memory difficulties, but these difficulties are not noticeably disrupting the person's daily life, affecting his ability to complete tasks as he would normally have done. Will appreciate that as one gets older, there are changes which takes place in his brains and his body. This may affect his physical or mental ability. There will be memory difficulties, but these difficulties are not noticeably disrupting his daily life, as opposed to Alzheimer's, where there is an obvious disruption in the person's daily life. Age-associated memory impairment does not affect an individual's ability to complete his task as he would normally have done. In Alzheimer's, the same cannot be said. There is no difficulty in learning or remembering new things in age-associated memory impairment. The same cannot be said in Alzheimer's disease. There is no underlying condition that is causing your memory problems. Remember, we spoke about diabetes, high blood pressure, and congestive cardiac failure as being leading to impairment in the blood supply to the brain, hence leading to memory difficulties. But in that case, we do not see these sort of memory difficulties in the aged person, but in the person with Alzheimer's, these conditions, because of the impact on the blood supply to the brain, can in fact lead to the progressive development of Alzheimer's disease. If we are noticing these changes in our parent or elderly relative, we should begin to appreciate that these changes are associated with just the natural process of aging and not Alzheimer's disease or dementia. So the take-home message here is, if your relative or your family member is experiencing memory difficulties, there are certain things you can look for to help to distinguish, is he suffering from Alzheimer or is it just because he's getting older? For example, is he able to learn new concepts? If the answer is yes, it's likely to be age-associated decline as opposed to be Alzheimer. Is he able to complete tasks that he has started? If the answer is yes, it's more likely to be age-associated memory impairment as opposed to Alzheimer's. Is he able to take care of himself? If the answer is yes, then again, it's more likely to be age-associated mental impairment. However, if you realize that there's a continuous decline in his memory and his ability to take care of himself, then you start looking more strongly at the possibility that it may be Alzheimer's disease. Almost 40% of us will experience some form of memory loss after we turn 65. Frightening, is it? This doesn't mean that we have dementia. Again, if almost half of us will experience some form of memory loss after we turn 65. Although as we get older, our chance of developing Alzheimer is higher, the fact that 40% of us will develop some degree of memory loss, it does not necessarily mean that we will all develop Alzheimer. For most part, our memory loss will be mild enough to allow us to live our day-to-day lives without interruption. So that is very key. When we're looking at evidence of decline in our memories, if we're able to take care of ourselves, hey, that is unlikely to be Alzheimer. However, you remember Alzheimer occurs in a number of stages. So it depends on the stage at which the person is. So it's a difficult sort of scenario. Maybe with time, it will eventually reveal itself. The World Health Organization, however, estimates that after we turn 60 years old, 5 to 8% of us will live with dementia at some point. Scary, isn't it? With dementia, symptoms include memory loss, gradually worsening our abilities. With dementia, symptoms include memory loss. This gradually worsens and our ability seriously deteriorates, and we are no longer able to take care of ourselves. There's a condition we call mild cognitive impairment. Between age-associated memory impairment and Alzheimer's disease, mild cognitive impairment seems to exist. This is a condition where the symptoms are mild. You may experience memory loss and symptoms such as difficulty speaking and disorientation. These are not sufficiently severe to interfere with your normal daily functions and routine. This condition, though, increases your risk of developing Alzheimer, but it is not Alzheimer's disease. If you have this condition, though, you are at increased risk of developing Alzheimer. Now, we try to distinguish between Alzheimer's and dementia disease. When memory loss is severe, where it is affecting your daily life. So again, if your memory loss is having a negative impact on your daily life, then it's more likely to be sort of Alzheimer dementia picture. If you are failing in your ability to adhere to your normal routine, then again, that points a finger towards Alzheimer or dementia. You're finding it difficult to learn new things. Obviously, if your brain mass is shrinking, where are you going to store the new information? So with Alzheimer, it is difficult, or it becomes increasingly difficult for you to learn new tasks. You'll also find it difficult to complete tasks. You may start something off okay, but to complete it may be challenging. Others close to you are starting to notice changes in your abilities. then these changes could suggest that you may be in the early stages of Alzheimer's. So if you have a relative, an elderly relative who starts displaying these features, close observation will help you to determine whether or not he's going down the route of dementia or it's just age-associated memory challenges he's having. Interestingly, we have been told that women have a longer lifespan than men, and that's generally true. But we also find that Alzheimer's disease is higher in females than in males. The prevalence increases dramatically with age, from less than 1% at age 65 to about 15% of people in their 80s. So there's a dramatic, rapid increase as you age. From age 65, it's less than 1% of persons will be suffering with Alzheimer's, but it gets up to 15% by the time you hit your 80. Why is this disease more common among women, I hear you ask? Could it be because women have a longer lifespan than men generally? Or is it because the sex steroids or the sex hormones offer some sort of protection against the development of that condition? We do not see Alzheimer's disease in premenopausal ladies, but similarly, we do not see the disease in males before age 50. Could sex hormones be protective? It may well be. In fact, I'm due to give a talk in March of next year on the same condition to a Japanese audience, where I am indicating to them that the use of HRT is the single strongest argument for female genital organ removal. That is to say, the removal of her ovaries and her uterus. But of course, that's not the topic of this discussion, so we'll continue on. We'll look at menopause and Alzheimer's. In females, menopause involves the withdrawal of the lady's hormones, which she have lived with for 39 years. That's from the time of menarche, the time she first had her first menstrual period, to the time when she had her last menstrual period. The average age of what we call menarche, the first menstrual period, is about 12 years in the UK. And the age of menopause is about 51 in the UK. So for 39 years, this woman has had her hormones in her circulation. Suddenly, these hormones are withdrawn, which has an adverse effect on her brain, and as such, we start seeing brain dysfunction developing. Obviously, the question is why? Do sex hormones play a role in brain function? We know that there are estrogen receptors found throughout a variety of structures in the brain, which deals with memory, concentration, and moods. We also note that individuals deficient in estrogen are more likely to develop Alzheimer-like symptoms. Is there an answer here? It seems that way. If when you are short of estrogen, you develop Alzheimer-like symptoms, you are put on estrogen replacement and suddenly you recover your functionality, it would seem that estrogen is playing an integral role in your whole memory process. We know, for example, when menopausal ladies come in asking for HRT, one of the things they describe is mental fogginess. That is easily treated with estrogen. You put them on estrogen and the next week you see them, they're the happiest persons yet. Okay? So estrogen seems to play a meaningful role in the onset of Alzheimer's. But I have some further information for you. Estrogen by itself, that is not combined with progesterone, allows improvement in patients experiencing mental fog, which is what I just said. Right? So if you have this mental fog where you're finding you're almost in a dreamy state, a little bit of estrogen improves that tremendously and almost immediately. It has been shown in animal studies, here it is, that progesterone reverses the beneficial effects of estrogen on memory. So we know estrogen is beneficial, but we add the progesterone, bam, the beneficial effects that estrogen has begins to fade. Okay? Estrogen replacement therapy improves the powers of recall in patients having challenges with their memories. The ability to learn new information is also improved with estrogen. So if this is not a strong argument for the use of estrogen in our menopausal ladies, in light of the fact that Alzheimer is more common in the aged female than in the males, then estrogen replacement brings about an improvement in that functionality. One would argue strongly that estrogen replacement can play a useful role in the management of these patients who suffer from memory challenges. This brings us to the end of episode 2 on Alzheimer. In this section, you were introduced to Alzheimer's disease and how it differs from dementia. Arguments for Alzheimer being the most devastating disease of all time was explored. Though Alzheimer's disease is one disease, for the purpose of learning, it was subdivided into a number of stages. Risk factors of Alzheimer's disease were explored, and there may be an infectious etiology, but this seems to be multifactorial. In other words, there are several causes for Alzheimer's development. You were given an explanation for the greatest incidence of Alzheimer's disease among females as opposed to their equally aged male counterparts. I thank you.